When we talk about heart attack and a patient has suddenly had a heart attack, the first thing, if you're at home and you have this crushing, intense chest pain or breathing difficulty, and you think you're having a heart attack, dial the nearest hospital, nearest nursing home to come and get you, because you may have survived the attack, but you definitely need further medical attention. So the first thing you have to do is get to a hospital. Why do you need to get to a hospital? Because we need to confirm what happened. So the first thing you have to do is go and get an ECG done. If by any chance, normally in say about 90% of the cases, once I look at the ECG, I know if it's a heart attack or not. But sometimes we don't know. And then the ECG looks normal. So then the doctor will do another test that is called the troponin test. Now, that is a cardiac enzyme test, and typically we do it 6 hours after the pain. Now, if your cardiac enzyme test is positive, it means you had a heart attack. If that also comes negative, then the doctor will do your echocardiogram and your trip. At the same time, whenever the patient has pain, we immediately start giving some blood thinning agents called antiplatelets. We give some statins, that's cholesterol lowering agents. All these things, treatment will be started immediately for the patient. And these things cannot happen unless the patient reaches the nearest emergency center available. Again, if it really turns out to be a heart attack, the patient will require an urgent angiography. And that can only be done in an equipped center. So please, to everybody who's listening to me, if you think you're having your heart attack and you think that the pain has passed, you're fine, please don't take it lightly. Rush to the nearest medical center available over there. It will save your life. Heart attacks are deceptive. Sometimes they start with pain. It'll settle down for a couple of hours. It will come back. It's not going to go away. Sometimes this staggering pain occurs over weeks. And suddenly the patient collapses in the office or at home, and it's too late. So if you have pain, you have chest discomfort, you feel something's not right, please visit your doctor, get yourself checked out, get these tests done, which I just spoke about. So when a patient has a heart attack, the first thing that we do for the patient is do an angiography. Once we've confirmed it's a heart attack, patient goes to cath lab, and I do an angiography for the patient, and we find out what is the problem. Now, if it's a single vessel disease or a double vessel disease, usually a simple angioplasty is enough for the patient. So what is an angioplasty? It's typically we take a wire into the artery, we balloon it or we pull the clot out, and then we put a stent. Now, this is a relatively minimally invasive procedure and takes about, say, half an hour, sometimes even 15 minutes. After that, the patient goes to the ICU. There's no incision. Patient is not made unconscious or anything. And recovery is fast. Patient goes home in maybe 1-2 days. Now, if while I do the angiogram, I find the patient has left main disease, or the patient has triple vessel disease, extensive disease, then the patient goes for a bypass surgery. And if the patient goes for bypass surgery, it's an open heart surgery. So typically then the hospital stays about 8 days and the patient takes another, 15-20 days at home to recover from it. So what is most important in this period? Whether you've had an angioplasty or you had a bypass, the most important thing is that you remember to take your medication after the surgery. You remember to stick to the activity protocol which is prescribed for you. So typically in the beginning, you have to take it easy. You remember to follow the diet chart also, which is prescribed to you. So these are very important things if you're a cardiac patient and you had a recent angioplasty or a bypass surgery. After one heart attack, patients frequently ask me, "Doctor, can this happen to me all over again?" And I say that it should not. I've usually fixed everything when, I've gone in and done the procedure. But coronary artery disease is a progressive disease and it can happen again and it can come back anytime because these patients usually have a long lifespan and there are changes in the body which keep on happening. Now, how do you check? So, first of all, once a patient is a cardiac patient, that patient is always going to remain on a follow up of a cardiologist. So, once I do a procedure, there's a schedule of visits after 1 week, then after a month, and then every 3 months thereafter. Typically, between 9 to 12 months after a procedure, we run a set of tests, for example, an echocardiogram, certain blood tests, a treadmill test, and we see if everything is okay. If we find any of the tests abnormal, we might subject the patient to a repeat angiogram to find out if everything is okay or not. How does the patient know? So that is again very simple because angina is the biggest mimicker. So if a patient has had angina once in his lifetime, if he has it again, he will know. It's always going to happen in the same way. So if that patient presented with central chest pain, the next time he has an episode, it'll be the same. If he presented with, shoulder pain, the next time he has it, it'll be the same. So what typically people who come back with the symptoms of a second heart attack coming in, they will typically complain that, oh, earlier I used to take 5 rounds and nothing used to happen. And now in my 4th round, I start feeling some heaviness, some tightness, some discomfort, or some breathing difficulty. And the moment they say that, we immediately run tests. So very important for the patient is, what were your initial symptoms? Remember, if you ever have them, come to me quick. Second is, don't miss your regular routine checkups, which we schedule for you. Those are to pick up if you're going to have a problem again. Third is, remember to run your yearly tests. And fourth, never forget to take your medications and never forget to stick to the lifestyle that we prescribed for you. When we talk about long-term effects of heart attacks, there are a lot of them. For example, a lot of patients, the pumping of the heart goes down after a heart attack and they develop what is called LV dysfunction, which means that if they walk or if they exercise or if they, try to do strenuous exertion, they become breathless. So LV dysfunction is one of the long-term complications. Then there are also chances of arrhythmic events occurring because when you have a scar in the myocardium, you can have a scar VT or something. And we put devices for patients called AICT, that's like the automatic implantable cardioverter defibrillator for people who have LV dysfunction and who have rhythm disorders. Sometimes patient can develop leakage in the valves because of a heart attack. Sometimes they can also develop a hole in the heart. So after a heart attack, there are a lot of things which can happen, which is why we say that anybody who has a heart attack needs to come to the doctor fast. If the patient reaches me within 6 hours, most of the things which have happened in the heart can be reversed almost completely. But the later they come to the doctor and the later we revascularize the vessels, the worse are the outcomes. So if a patient comes fast, the pumping of his heart comes back to normal, his arteries again become pristine clear, they do very well. But a lot of patients, they come in very late. There's a delay between the event and the time they've come. And the myocardium of the heart, the muscle is damaged. And these are the patients who have long-term problems, arrhythmic events, LV dysfunction, low cardiac output, fatigue, heart failure, all of these things which can happen. And then we have various ways in which we deal with all of these things. So we always say that lifestyle has a great role in treating cardiac patients. And I've seen many of my patients who are motivated enough undergo a dramatic change. So diet is very important. So if you're taking if you had a heart attack, what is important is you have to take a diet which is high in green leafy vegetables and fresh fruits. So multiple servings of those. Second is you have to maintain your calorie count and make sure that you don't put on weight, because for obese patient, the heart has to work even more. So diet rich in green vegetables and fruits is good for the patient. A certain amount of salt is allowed for the patient, because if these patients have LV dysfunction or they are hypertensive, then we limit the amount of salt. Second is exercise, very important for patients for their heart to come back. So we always recommend the exercise depending on what is the condition, the physical condition and the pumping of it. For people, most of my patients, if they've had an elective procedure, then the heart goes back to normal. And many of them with even 3 stents are running 42-kilometer marathons. But then it varies from patient to patient. For example, if I have a patient whose pumping is very down to 20-25%, we would recommend only walking for that patient. But for somebody whose pumping has come back to normal, they can run, they can cycle, they can swim, they can do whatever it wants. But some form of exercise, depending on what is the pumping of their heart, is very important for every patient. So for anybody who's had a heart attack out there, the most important thing is please don't neglect yourself. Don't neglect your heart. Make sure you get to the cardiologist and you get the treatment that your heart deserves. If he recommends that you need an angioplasty or a bypass, please get it done to make your heart healthy all over again. And after that, make sure that you take your medication regularly, you come for your routine checkups, you follow the exercise regimen which is recommended, and you stick to the diet plan that is given to you. What we commonly see is that once the patient is okay, they forget. They forget that they had a heart attack and they forget to take their medication and they go back to their old lifestyle and they start drinking and smoking all over again. And that's where the entire problem comes back in again. So once you've had a heart attack, please remember to listen to whatever the doctor has told you and follow your diet, your exercise, and your medication regimen, and say no to smoking, say no to alcohol. It's not good for you.